Greetings, this is Dr. Sandra Cabot. I'm talking to you today about whether you should have a blood test to check your liver function. Well, I believe the liver is such an important organ that it's wise for everyone to have their liver checked with a blood test annually. So when you go for your regular medical checkup, make sure that it includes a test for liver function and discuss it with your doctor. Make sure that you understand the results and that it's within the normal limits. Many people don't realise that the liver can easily be damaged by lifestyle and environmental factors, and that this damage can occur to your liver without producing any obvious signs or symptoms. So it can smoulder on for years, become chronic, slowly causing liver damage, and you may not be aware of it. Now, a liver function test is even more important in those who have a fatty liver, those who have risky behaviour such as using intravenous drugs or recreational drugs or excess alcohol, those who have diabetes, those who have unsafe sex, as this is a common way to catch the hepatitis B virus, which can cause chronic liver disease. Those who have many or regular tattoos or share needles, razor blades or toothbrushes, because these hepatitis viruses are blood-borne. Those who have had a blood transfusion before the year 1987, those who work with toxic chemicals, those who take long-term prescribed medications, particularly if they're taking 2 or 3 or more drugs together, and they're doing it for several years. These drugs can damage your liver, and some people are more susceptible than others, so make sure that your liver function is normal while you're taking medication. Those who have elevated levels of iron in their blood need a liver function test, and those who have a family history of liver disease. So it's even more important to have your liver checked if you have these indications. Remember, the liver can become damaged without producing any symptoms or signs, and this is why a blood test is so important, because it will show it. It's very accurate. Now, what are the common causes of abnormal liver function tests? Well, the most common cause is fatty liver, and this affects 1 in 3 people, and it can cause liver inflammation, which will show up as abnormal liver function tests. The other common cause is excessive intake of alcohol. Early cirrhosis can present with nothing more than elevated liver function tests, so that liver enzymes are too high. Infection with viruses that cause hepatitis. Hemochromatosis, now you may not have heard of that one. That is a genetic condition where your body cannot regulate the levels of iron in your body. So you have too much iron. We call it iron overload. And this is common in people of Northern European ancestry, so Irish, Scottish, English. It's a recessive gene that occurs in those races. The other common cause of abnormal liver function tests is drug side effects. The most common drug culprits are the cholesterol-lowering drugs, painkillers, non-steroidal anti-inflammatory drugs, some antibiotics, anticonvulsive drugs, and immune suppressant drugs. Now, note that non-steroidal anti-inflammatory drugs are available over the counter in many countries, and thankfully will soon require a warning on the packet that they can be liver toxic. Also remember, the commonly used painkiller / analgesic acetaminophen, also known as paracetamol, can be very liver toxic. So what are some of these liver function tests that we look at? Well, in the blood test we measure the level of the liver enzymes. So the enzymes are normally found inside the liver cells, and they're enabling the liver cells to perform their functions. So there's normally only low amounts of these liver enzymes in the blood. if they are elevated, it means that the liver cells are damaged and their cell membranes become damaged, and they will leak out excessive amounts of these liver enzymes, and they'll go up in the blood test. So the liver enzymes we measure are called AST, ALT, AP and GT. And sometimes there's only one or two elevated, sometimes they're all elevated, but it's significant. And the higher the elevation and the more enzymes that are elevated, the more significant it is towards pointing to liver inflammation and or liver disease. The other thing we measure in a liver function test is the level of the blood proteins albumin and globulin. So your liver manufactures these proteins, albumin and globulin, and if your liver's not working properly, you may have low levels of albumin. The other thing we measure is bilirubin, and bilirubin is a waste product from the breakdown of red blood cells, and it's processed by the liver and then excreted through the bile into your stool. It's a yellowish coloured pigment, and it can build up in the blood if your liver is not processing it right, and a damaged liver cannot process bilirubin well. So this can be a sign that you've got a liver problem. The other thing we measure is ferritin, what we call the serum ferritin, and that is an important marker for liver disease. And it's something that's not always measured routinely, as it should be. It should be a routine liver function test, or a component of a routine liver function test. So iron is stored in the body, mainly stored in the liver, and it's stored in the form of ferritin. So this is a particular storage form of iron. And injured liver cells will leak ferritin into the blood so that the levels will be elevated on a blood test. So serum ferritin levels are commonly elevated in patients with non-alcoholic fatty liver disease, patients who are obese, patients who have excessive inflammation from chronic disease, or those who imbibe excessive amounts of alcohol. There can be a genetic cause of elevated ferritin, which we mentioned, hemochromatosis, but that is not nearly as common as the fatty liver, weight excess, alcohol cause. Now, very high levels of serum ferritin, around the 1000 level, are a predictor of advanced liver fibrosis or scarring. We call it cirrhosis. And if that occurs in a patient with non-alcoholic fatty liver disease, it means they really need to do something about it. Otherwise, their fatty liver will lead to cirrhosis and liver failure. The other thing is very high ferritin levels can indicate a hidden cancer or a hidden infection, but generally it's just due to liver inflammation, and it can be reversed. Now, some laboratories will consider serum ferritin levels greater than 200 in women and greater than 300 in men to be abnormal. So if it's only slightly elevated, obviously you're in the early stages of liver inflammation, but if it's getting up there around the 1000 level, that means your liver's very inflamed. And thankfully, we can do something about it. I've seen it many, many times. When you improve the liver function, the elevated serum ferritin levels will come down to normal. I've had patients who are heavy drinkers, their serum ferritin is above 1000, and that comes down to normal within 6 months of cutting the alcohol or improving their diet if it's a fatty liver problem. Now, if the serum ferritin levels don't come down over 6 to 12 months, we have to look for other causes such as a hidden cancer or infection. So liver function tests, very accurate, very worthwhile, will often pick up early stages of liver disease before you have any symptoms. And that is good because we can reverse most types of liver disease. The liver responds very well to nutritional medicine. So if you have any questions or want more information, visit liverdoctor.com. We have lots of great articles and podcasts there. And feel free to email us from liverdoctor.com or sandracabot.com, and thanks for listening.